All right, today we're going to unpack a condition that honestly affects millions of people but is so often misunderstood. It's called chronic edema, and it is so much more than just swelling. Really understanding it, well, that's the first huge step toward managing it. So let's just dive right in.
I want you to just imagine for a second. This is the very first thing you hear from your doctor after a health scare. You've got lymphedema. It's incurable. You need to wear a stocking. That was the real, blunt diagnosis given to patient advocate Matt Hazeldine. It's so stark, so cold, and for way too many people, that's exactly where this journey begins.
And that's the thing, this isn't just Matt's story. For millions of people, this is their story too. It's this sudden, jarring introduction to a new reality, a condition they're now going to have to manage for the rest of their lives. And when we say millions, we mean it. To put a number on it, here in the US alone, it's estimated that somewhere between 3 to 5 million people are living with secondary lymphedema, which is a major form of chronic edema. That is a massive number of people all navigating this really complex condition.
So yeah, a diagnosis like this is absolutely life-changing. And we're about to explore exactly why it's about so much more than just the physical swelling you can see.
So, what is actually happening inside the body, like on a biological level? Let's break down the science. And probably the easiest way to think about it is to picture a city's drainage system getting completely clogged up.
The clinical definition is pretty straightforward. Chronic edema is any swelling that sticks around for 3 months or more. And at its very core, it's basically a breakdown in the body's super intricate fluid management system.
And that clogged drain analogy? It's actually perfect. See, our lymphatic and venous systems, they're designed to constantly clear out excess fluid from our tissues. But when they can't keep up, that fluid backs up, and that's what causes the swelling. And this slide right here really shows you the difference. On the left, you see a healthy system. Everything's in balance. The fluid that comes in is the same as the fluid that gets drained away. Perfect. But on the right, that's the system with edema. It's just a state of constant fluid overload, and the whole system starts to fail.
And that overload, it kicks off this really nasty, vicious cycle. First, the fluid builds up. Then, that buildup triggers a chronic inflammatory response. Over time, all that inflammation causes the tissue to actually harden. That's called fibrosis. And guess what? That just damages the already struggling drainage system even more. It just feeds on itself.
Okay, so that's the problem. And it sounds pretty bleak, right? But how do you fight back? Well, the good news is there are proven ways to take back control. It really all boils down to what are known as the cornerstones of care, which are designed to put the power back in the patient's hands.
So, experts have boiled it down to these 4 key pillars for self-management. Now, for our purposes, we're really going to zero in on the 2 most critical ones, the ones that are just the absolute foundation of daily care: compression and skincare.
And let's be crystal clear about this first one. There is zero debate in the medical community. Compression therapy is the absolute gold standard. It is the single most important part of managing this condition, period.
And this is exactly why. Compression isn't just a passive thing. It actively fights back against the condition. It physically squeezes the swelling down. It helps the body's own natural pumps work better. It dials back that chronic inflammation, and it protects the skin from really dangerous infections like cellulitis. But let's get real for a minute. It's easy for a doctor to say, wear a stocking. Living it? That's a whole different ballgame. As this quote points out, the daily struggle of just putting on and taking off a medical-grade compression garment, it's a workout every single day.
All right, that brings us to the second cornerstone, which is just as vital. And that's because the skin on a limb with edema is incredibly fragile and vulnerable. So good skincare isn't about looking good, it's the body's first line of defense against serious infection.
And the protocol is pretty simple, but it is non-negotiable. Step 1, cleanse the skin every day with a gentle pH-neutral soap. Step 2, protect it by slathering on emollients to keep it moisturized. And step 3, restore. You just have to do this every single day to maintain that critical protective barrier.
Okay, so knowing about the tools, compression, skincare, that's one thing. But using them correctly, that's where having an expert in your corner becomes absolutely essential. Let's talk about why getting the treatment exactly right is so critical to actually succeeding. Because here's the thing, not all compression is created equal, not even close. Using the wrong type of garment, or maybe the right garment but with the wrong amount of pressure, it's not just ineffective, it can actually make things worse. We're talking pain, skin damage, and it can totally destroy a person's faith in the therapy that could change their life. They just conclude, well, I guess this doesn't work for me.
And this table gives a fantastic snapshot of how tailored the approach needs to be. It's basically a two-phase strategy. First, you've got the intensive phase, where the goal is to actively reduce the swelling, to physically push that stubborn fluid out. For that, clinicians use stiff, inelastic bandages that give you high resistance. Then, once you've made progress, you switch to the maintenance phase. The goal here is just to hold on to those gains. And that's when you use more flexible, elastic garments for long-term daily wear to keep the swelling from coming back.
And of course, everything we've just talked about is built on one single pivotal moment: getting an accurate diagnosis. It is the absolute foundation. A specialist has to be sure that the swelling is actually chronic edema and not something else like heart or kidney failure, because the treatments are totally different. Getting that first step right means the patient gets on the right path from day one and doesn't waste time on treatments that won't work or could even be harmful.
So, we've covered the what, the why, and the how of treatment. But let's end by focusing on the who, the person actually living with this day in and day out. Because the goal isn't just to manage a symptom, right? It's to live a full, happy, active life.
And this is where we see all the hidden challenges, the stuff people don't always talk about. That daily physical grind often comes with a huge mental and social weight. You know, body image issues, feeling isolated, anxiety, plus the simple, maddening frustration of not being able to find clothes or shoes that fit.
But with the right knowledge, the right support, and the right tools, a really crucial shift in mindset can happen. I just love this quote because it's all about taking back control. It's about empowerment. It's about agency.
And really, that's what it all comes down to, isn't it? It leaves us with this final, powerful question to think about. How can we, all of us, patients, doctors, everyone, how can we shift the whole conversation away from that scary word, incurable, and start focusing on the life-changing power of the word manageable?